Hello there and welcome to The Pulse. We're coming to you live from our studios here in Accra. We are your home of independent, fearless and credible journalism. Coming up this afternoon on The Pulse, we need to talk about this. LaBianca Company Limited denies wrongdoing in its dealings with the Ghana Revenue Authority. We have details as the company describes the OSP's recent report as going contrary to the due process and fair trial. Also this afternoon, provisional data reveals government has so far received less than 7% of its e-levy targets. We'll bring you details, plus get you some updates as it has officially begun. The EcoBank JoyNews Habitat Fair 2022 is happening. We'll tell you about the many discounts available to you as a potential patron. It's all coming up here on The Pulse. And that reaction continues to greet the decision of the YEA to recruit more senior high school graduates for its nurses and community nurses program. And you're welcome back to The Pulse. I am Blessed Sogah. We are not posting senior high school graduates to act as nurses or doctors. That's the response from the Youth Employment Agency after it received backlash over its ongoing enrollment of high school students for deployment to rural health centers across the country. Well, the job description of the recruits is to have SHS leavers help nurses with recording of medical history and symptoms, including physical examination and providing simple bedside care to patients, mostly in rural communities. However, the Registered Nurses and Midwives Association is describing this move as worrying. We'll hear from the group's General Secretary shortly, but the Corporate Affairs Director for the Youth Employment Agency has been providing some more details as to why the YEA intends to roll on more nurses to serve in the communities.
To the health of Mother Ghana and everybody in here. So we acknowledge the work of doctors, we acknowledge the work of nurses, we acknowledge the work of midwives and so on and so forth. However, I'm not sure everybody can do every kind of job in whichever field they are. And we have a basis for what we are doing, which is greatly supported by the World Health Organization. It's supported by the African Union, and it's supported by the Parliament of Ghana, the Ministry of Health. In fact, we are doing this under the auspices of the Ghana Health Service. It'd be very surprising to believe or think that the Ghana Health Service, the Health Subcommittee of the Parliament of Ghana, and the Ministry of Health have not gone through all of these things that we are talking about and have not really thought about it. What we are doing is, first of all, to create employment for the young people, young men and women of Ghana. Secondly, to attend to primary health care delivery in preventable health care, and especially in the rural communities. We are not posting anybody to any big hospital like the Bank Hospital here in Accra. We are not posting anybody to, for example, the Tamale Regional Hospital or the Northern Regional Hospital in Tamale. We are posting them to the Chief's compound. We are posting them not to act as nurses. We have been very explicit on this. Not to act as nurses, not to act as doctors, but to act as preventive health service officers. My brother, you would agree with me that we are in the rainy season, for example. Cholera usually comes out as an outbreak every rainy season here in Ghana. What do we do that we get cholera as an outbreak every rainy season here in Ghana? It is because of little practices that we have in our homes.
Yeah, but if you may, I mean, if you look at the concerns from the group, they're saying the CHIPS compound actually formed the basic unit of our healthcare system. You don't want to dwell with that, particularly knowing how difficult it is for some in the rural communities to access some of the district facilities.
Where did we write that community health service providers are going to man the CHIP compounds? We haven't said that anywhere. We are not saying that they are going to be administrators of CHIP compounds. We have not said that they are going to administer injections to anybody. We have not said that they are even going to take temperatures of anybody. They are going to assist the professionals.
But there are a raft of measures, or I mean, some of the services they'll be able to provide, and that, for instance.
So if I may, you have a list of that. Yes, explain it.
Right.
If I may, and he understands that none of our recruited people are going to provide these services that are provided by professional health service providers, and that is what we are talking about. That, for example, pick a folder for me. If I'm a nurse and I'm attending to a patient, pick a folder for me. What kind of expertise do you need to pick a folder for someone? attend to or educate people in their houses on the fact that you don't need to defecate anyhow so that we can prevent cholera outbreak? What kind of expertise do you need to be able to do that? These are young men and women we are taking out of these communities, very remote areas where you post midwives and they don't want to go, where you post doctors and they don't want to go. That we should be able to prevent, for example, outbreaks. When Corona came out, we needed people to go into houses to educate people on how to wash their hands, how to bath, how to do things when they come back from town. It's the public and these people that you will get into place. These are people with aspirations to become nurses. And they call them SHS leavers. We don't call them SHS leavers. They are graduates of SHS. Some of them don't have the requisite certification yet. Others have the requisite certification, but they don't have the funds to be able to apply and get to the nursing training.
Well, so that's the position of the YEA. You heard them indicate there clearly that some engagements are taking place between the Ministry of Health and also the Parliamentary Select Committee on Health. So let's cross over now and speak to Kwabena Minta Akando's ranking on Parliament's Health Committee. Thank you for the time here on the JoyNews channel. So indications there we're getting from YEA is that extensive consultation has gone into this policy measure. But we're learning that the minority is not pleased with the approach that the YEA is adopting in this. What's the position of the minority on this?
Start with the gentleman who spoke. Who's that gentleman? He's a PRO for the YEA?
That's the Director of Corporate Affairs, Mr. Free.
Okay. Hey, from what I heard, from what you have just played, the gentleman is ignorant about what he's talking about, number one. Number two, what the indication he gave that the Parliamentary Select Committee on Health was consulted on this matter is palpable falsehood. I sit on the Parliamentary Select Committee on Health, and I am the ranking member on the committee, and I do not know anything, absolutely nothing about this.
Are you claiming that this is the first time you are hearing?
This is the first time I am hearing. This is the first time, in fact, I heard it in the public domain, that the ministry is going to, or government is going to engage such people to go and perform the role of a community health nurse. Number two, the roles that he outlined, the preventive health care, educating people about what the do's and the don'ts, or what they should do and what they should not do to be able to prevent cholera or malaria, it's a professional job. So if he asks the question, what expertise do you require to do that? Clearly, he's ignorant about what he's saying. In fact, the job description that he gave, as I was listening to him, fits clearly in the responsibilities of a community health nurse. And that we have more than 19,000 of such people sitting at home since 2019. Take note, I am not against anybody recruiting anybody in the name of giving the person job. But if you have professionals who are also youth, in fact, if you take their own act, the Youth Employment Agent Act, 2015 Act, I think at 887, the definition of youth is the ages between 18 to 35. And they are supposed to facilitate the employment of such group. Now, the people who are at home now, since 2019, the committee has said, well, I can tell you on authority that more than 99% of these people fall within that bracket. So why are you then going to recruit people and go and give them training whilst we have these professionals sitting at home? If we are not careful, because you see, for somebody to assist somebody, what it means is that there should be somebody performing a particular role and a second person assisting that person. And we are saying that, look, these people are sitting at home. Instead of you engaging these SSS graduates, why don't you engage the professionals?
No, but fact, if you look at the amount being paid to this SHS graduates, obviously you do agree that that cannot be equated to how much we would have to pay these professionally trained nurses? And beyond that, just look at some of the roles they are playing, just bedside services and assisting the professionals. Is that too much to ask from these SHS graduates?
The very reason that because of how much they will be paid, that is dangerous. That is, so because we cannot pay the professionals, we should go and get, non-professionals and go and train them to do the work. Is that what you're telling me? If you are not very careful, within the shortest possible time, we will say we are going to pick SSS graduates and train them to be able to assess medical doctors. Meanwhile, we have physician assistants. Do you understand? And so, for me, it doesn't make, in any case, if you cannot pay the professionals, what shows that you can even pay the non-professionals? Because we are here. Even NAPCO. And whether you know, how government is even finding it very difficult to pay NAPCO. So if it indeed, government do not have money to pay their professionals, then it is going to be very difficult to be raising money to pay them. Or are you telling me that they are going to work free of charge, or you put them in and their face will just be like the NAPCO people? It doesn't make any sense whatsoever to do this. And so, look, if we make law, the law must make sense, and the law must serve the people well. For example, if we need about the community nurses, we need about, let's say, 6,000. And then the people available are about 4,000. After recruiting that 4,000, we'll still have a gap, a deficit of about 2,000. Then you bring a law. Let's train people. And even such situations are under emergencies. Let's train 2,000 people to be able to fill the gap. Then within the medium to long term, we'll be looking for the professionals to fill the gap. That makes a lot of sense.
But just take a look at it. Just take a look at it. The backlog that the registered nurses are dealing with has got to do with over 10,000 members. You agree, government may not have the finances ready, in this time of crisis,
even if that is the case, and you are going to engage 5,000, why don't you engage 5,000 out of the 10,000 you are talking about? Why? Governance is all about common sense. So today, if these people are talking this way, you can engage and say, look, the recruitment we are doing is out of the number we have, the backlog. So as and when we get more, we can recruit more, we can engage more. But you don't leave the backlog because it is huge. You don't tackle it at all. Even if they had recruited 1,000 out of the backlog, this debate wouldn't have arisen.
Okay. So the way forward, what do you intend to do about this? Just hold on. What do you intend to do? What do you intend to do as minority in parliament, and what's your expectation of government and the why?
The way forward is that, number one, they should not lie. They've not engaged us. Number two, they should stop it. They should stop. The recruitment of the SSS graduates, and then if they can find something different for them, that is fine. But as far as the job description they have given is concerned, that we have professors enough at all. They should engage them. Even if they cannot engage all, and they engage half of the number sitting at home, at least, everybody will understand. We will be reasonable enough to understand that, look, we are not in normal times and all that. But to sideline them, these people have demonstrated, they have gone on whatever, and government is pretending as though he has not seen anything, he's not heard anything, and then you are just, ignoring them as if they are from Russia or Ukraine or Czechoslovakia or whatever. I don't know Ghanaians, I don't know youth.
Yeah, and that's why I'm asking what you intend to do as a minority on this. Will you take on
the government? We'll follow up. So I have just gathered you this interview. I've spoken to a lot of people. I think that they must listen and then do the needful. They should engage the association and then, if possible, try and recruit some of them, even if not all. So I will take it from there. Or else they will hear from us.
Yeah, but another assurance we're getting from YEA is that all of these senior high school students or graduates that will be deployed have been or will be, and because the deployment may happen in a few months from now, will be taken through some thorough training so that they have an understanding of the health sector and to perform all of these menial jobs, quote and unquote, if I could just use that word.
I am saying that these jobs they are going to train people of, we have these professors sitting at home. We have used our own resources as a country to train people. They are sitting at home now. You may not need to train them that much.
But how tenable? How tenable is your analogy, particularly when the YEA says they've been rolling similar modules in other parts of the public sector. For instance, take a look at youth in policing and other sectors.
Do you have anybody who has finished the police course and is sitting at home? Do you have any example of such situation? Tell me. Do you have anybody who has been taken through the police exercise recruitment and you call him a police? He is passed and then he's sitting at home. He has not been posted. Do you have any example that you may be charitable to share with me? Do you have anybody in military or fire service or something of that nature? Can you share with me? And we are talking about healthcare delivery. Please don't compare with any other sector. The finance minister, your own finance minister, when he was sick, he traveled to one of the most expensive hospitals in the world. He's there, and you are telling me that you are going to train what do you call it, SHS graduate to go and do what?
Anyway,
please, let's be serious as a country.
Right, we'll have to leave it here, but I'm grateful so much for your time. That's Kwabena Mintakano ranking on the Health Committee of Parliament. It's time now to...